Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Presidential Steering Committee collaborates with the National Primary Healthcare Development Agency, a maiden town hall in Nasarawa State, to educate community leaders on the coronavirus. WHO raises hope that COVID-19 may be on the decline in a matter of months if necessary steps are taken by countries to flatten the curve. And again, Nigeria recorded 0 fatality as the deaths from COVID-19 related ailments, which stands at over 2,000. This also shows that the death toll appears to be declining, even though global deaths tell a different story. Let's take a look at other data on the SARS-CoV-2 virus.
According to data from the Nigeria Center for Disease Control, NCDC, Lagos, FCT and Plateau State have recorded more deaths since the outbreak of COVID-19 in Nigeria. Other states like Yobe, Zamfara and Kogi have recorded less fatality from the virus. This is as the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, says that the world has now recorded over 3 million deaths so far around the globe, while the pandemic recorded 1 million deaths in 9 months. The WHO reports that in 4 months, the number of deaths went up to 2 million, while 3 months later, the 3 million mark.
We have the tools to bring this pandemic under control in a matter of months if we apply them consistently and equitably.
According to the WHO DG, new cases last week increased for the 8th week in a row, and countries like the US, Brazil, India, account for the countries with a high number of cases and deaths so far. According to the Nigeria Center for Disease Control, Nigeria has recorded 70 new infections from last night, a rise from the 26 confirmed cases registered in the previous 24-hour cycle. The 70 new infections were confirmed from 5 states, with Lagos topping the list with 27 infections. Kaduna and Ondo State registered 16 cases each. Yobe, 6 cases, and Bauchi confirmed 5 additional cases. The latest tally has now raised the total number of confirmed cases to 164,303. The health agency also reports that 52 persons were discharged after recovering from the virus, bringing the total number of recoveries across the country to 154,384. So far, 7,858 active cases have been managed across states and the FCT, while over 1.8 million tests have been conducted. NCDC is also asking Nigerians to be cautious of infectious diseases that can be easily transmitted, such as cholera, advising them to practice proper hygiene as well as a stricter adherence to non-pharmaceutical interventions. More than 1.1 million Nigerians have now received their first dose of the Oxford-AstraZeneca vaccine, according to an update by the National Primary Healthcare Development Agency on April the 19th. Lagos State leads the chart after having vaccinated more than 200,000 of its target population, followed by Kano and Kaduna in third place, who have vaccinated more than 50,000 of their target population.
The chairman of the Presidential Steering Committee on COVID-19, Mr. Boss Mustafa, has reiterated the efficacy of the Oxford-AstraZeneca vaccine. He was speaking at a town hall meeting on COVID-19 vaccination in Nigeria, organized by the committee in collaboration with the Primary Healthcare Development Agency for authorities of the North Central Zone. The meeting, which was held in Lafia, the Nasarawa State capital, was an opportunity for Nigeria's health officials to dialogue with stakeholders on the myths and misconceptions surrounding the COVID-19 vaccination. The exercise is to be repeated in other geopolitical zones of the country to broaden the advocacy on the efficacy of the coronavirus vaccine.
This vaccine is safe, is efficacious in preventing the spread of COVID-19. Your Excellencies, Royal Fathers, distinguished guests, ladies and gentlemen, with the availability of COVID-19 vaccines, we are more confident that sooner or later we shall overcome the virus While government will ensure the availability of the vaccines, the onus is on eligible citizens to demand for, make the extra effort to access the vaccines, and get vaccinated as and when due.
In Secretary of State, there seems to be less compliance to the COVID-19 prevention protocols. Our correspondent gathers that some residents still doubt the existence of the virus. It also appears that with the advent of the COVID-19 vaccines in the state, they believe it is an automatic protection against the spread of COVID-19.
People have become reluctant, and then this disease have become part of our lives. So people have become, the awareness is on, but they become used to it. So that's how the nature of human beings. Sokoto is not an exception. So people are aware of it, but they have not been compliant to the regulations, that such as using of face mask, spacing, and hand sanitizer, use of hand sanitizer at all times. So that's the nature. Actually, the usage has drastically gone down.
Well, according to experts, the delay in vaccine procurement on the African continent may result in apathy. Some health experts believe that with good publicity and continuous advocacy on the need to be vaccinated, the apathy can hopefully be resolved. Well, joining us in our Lagos studio, Professor Oyewale Tomori, a virologist, Chairman Expert Review Committee on COVID-19. Thank you for joining us on the program.
It's my pleasure.
First, looking at the NCDC daily figures, is there still COVID-19 in Nigeria?
Yeah, definitely there is. The fact that we're even getting figures, if you look at the figures, it tells you only about 5 states reported. We don't really know whether the states are testing, because they never let us know how many states are testing and how many are positive. I think that is an additional information we need to know. Of the 37 states, X are testing, only 5 are positive. That's what we call full information. And it's on the basis of that you can decide, properly evaluate what the situation is. But the fact that we're picking some of these cases, it means it's around.
So that's also a big problem, that we don't know about the tests states are conducting.
Yeah, you're right.
Looking at the variants, which appears to be a problem around the world, there appears to be controversy over the Nigerian variant somewhere in the United Kingdom. Fears spreading that it might be worse than the South African variant and the Brazil variant combined. Is there such a thing?
I think the first thing to say is that there's no Nigerian variant. If you check the times, this variant B1525, whatever you're calling it, it was found almost about the same time in Angola, in Nigeria, and in the UK. It's true that the cases they found in the UK were from Nigerian travelers. But the fact that you found it a day before in Angola and then this following day in Nigeria does not make it a Nigerian variant. Unfortunately, we got that tag and we had to keep by it. So it was occurring in different parts of the world. It is how fast you test that determines where you determine it. And whoever gets it first, unfortunately, gets the name. So really, and what has happened in Britain is that they don't have a proof yet of what it is. It's a speculation. It may. That's what you hear. You go and look at the thing and saying it looks like, because they're detecting more of it, because they're testing more. And it's a matter of the same situation we have in this country. The more we test, the more we find out. I mean, the variants we are finding in the country, our testing has not been what it should be. We think it should be better than what it is, but it's not. And that's why we have these gaps, and that they will not let us be able to predict or analyze and interpret effectively.
So essentially, we can't say we have a database of variants that we're seeing in the country.
We have, but it's not complete. That's the problem. If you notice, the first time we actually detected some variants in this country was sometime in December last year. But these were samples collected in August. So that gap, I mean, what you should be doing is, as soon as it is possible, get this testing done real time. And one of the things we had advised that on a regular basis, each of the labs that are testing the country, both positive and negative, on a daily, weekly basis, they should get these samples to the sequencing centers. And the earlier we do that, and what it requires is get the proper organization, the funding to get these labs to transport this. There are about 4 or 5 laboratories that are sequencing in the country, and we need to get the remaining labs over a properly synchronized system where on a weekly basis we get these samples to those sequencing labs. That's the only way we can provide answer. Or otherwise, we'll just be speculating on incomplete data.
In view of our vaccination plans and where we are, a slow rollout across Africa, we have countries like the UK putting India, that's going through a lot now, on the red list. Should we be thinking of doing something similar in terms of travel?
Yeah, I mean, the example of India is something that we should all learn from. You know, India was doing very well. Then they relaxed their a little bit of relaxation. You know, these Hindu festival and all those kind of things. They relaxed that, and boom, the thing came up. We're waiting for the next festival to occur in Nigeria. I believe we were not taking, because we have abandoned all the non-pharmaceutical diseases. A big celebration or whatever in this country could set us back into the third wave. We had a short period from about August ending last year, and then suddenly in December, coming with the Christmas, then we had a wave. I don't know what next ceremony we're going to have that will bring more people in the country. So we're having a lull now, but with the situation that is going on around the country, a lot of people not wearing their face mask, pharmaceutical and all this safe distancing not taking place, I think we are setting ourselves up for possibly a third wave that is coming.
Part of the restriction is the issue of the COVID-19 vaccine passports, which, a lot of the richer countries are looking at, starting pilots, UK, in the summer. What's your take on that, having a vaccine pass?
Well, okay, I think, first of all, the word vaccine passport, I think is a misnomer. This is not the first time we're having vaccination being used for travel. You don't remember the yellow card? This will be called yellow card. For yellow fever, maybe cholera, you stamp or something. I don't know why they end up with the word using passport for this one. And I think it is totally unfair. Why is it? Because vaccines are not available in many places. So you cannot begin to put a law in when there's no availability of vaccines. But if the vaccine was available to everybody, of course, then nobody will complain. But right now, we don't have the vaccine, and you say, I can't come in because of that. Well, it worked with yellow fever because, the vaccines were available. You could get it anywhere you wanted it. So, but then they were not even calling this yellow passport or whatever. So I think we should stick to the fact that this is a card that contains your vaccination history. That's it. That's the way I look at it.
Let's look at the numbers that have been vaccinated in Nigeria, 1.1 million so far, over that number. And this is the first dose that we know of. For those who might not get the second dose, what happens to the efficacy of the first dose? And what is the efficacy of a Oxford AstraZeneca vaccine?
Well, first of all, let me look at the word efficacy. We can't compare efficacy of the one that one has 90%, one has 60%, when you did not test them under the same condition. I think that's one of the problems. I think when people say somebody has 90%, you tested 90% in Europe. This guy tested his own in Brazil. The other one tested in South Africa. So we have different things. So we don't compare things like that, So right now, you can only say it's efficacious for the place where you tested it. And therefore, so that's the first thing. All WHO requires is have at least 50% efficacy. And that makes it as good as any other thing. Now, getting the first dose only ups your immunity up to a level. The second dose boosts it up. But then there's also that gap in between. I mean, normally when you get the vaccination, it will take you another 10 to 14 days before you actually develop immunity. So it's not the day you get the vaccine that your immunity comes up. But then you get that second dose. And sometimes the long interval between it also helps the body, to boost up the immunity. You remember with polio vaccination that we used to give our children regularly. Some also yellow fever. WHO comes back every 10 years. So there's no real hard and fast rule about in between when you should do it. I mean, you remember Britain turned it to 12 weeks, or the manufacturer said do it in 21 to 28 days. So it doesn't really matter. The important thing is that that first dose doesn't give you the level of immunity that you require. The second one boosts it up to a level that can say, I'm fully immunized. So if our people don't get the second dose, they will be protected, but not to the level that one is comfortable with. Therefore, we need that second dose to give that full immunity to our people.
All right. We'd like to thank you for joining us on the program. Professor Iwale Tomori, Virologist, Chairman, Expert Review Committee on COVID-19. Thank you once again.
It's my pleasure. Thank you, Millicent.
Let's go over to Ekiti State, where more than half of the frontline workers have been vaccinated and no major side effect reported. The state government says it is not relenting in testing and treatment of infected patients, as well as compliance monitoring. Our correspondent, Babajide Agbeyo, tells us more. Babajide.
Good evening, Millicent. In Ekiti State, the first phase of the COVID-19 vaccination has been concluded. 26,000 frontline workers have been vaccinated. They have all taken their first jabs, and the portion that will complete their second jab has been safely kept. There were initial reports that some of them showed reluctance to taking the vaccine, but with the public vaccination of some top personalities, coupled with aggressive enlightenment on the part of the state government, they eventually submitted to the exercise.
When the vaccine came, there was this apathy, there was this withdrawal, if I will say, even amongst healthcare workers, because of all the stories and the misinformation that had been generated on the social media because of the advent of the vaccine. But as time went on, when Mr. Governor took his jab, and the member of ESCO and everybody took their jabs, so people just watched over time to see that everybody is fine. So, and of course, people began to take their jabs. We also did aggressive risk communication and community engagement activities around the acceptance of the vaccine.
At the moment, there's no patient at the state isolation centers, but the state government has continued to sensitize the people on the need to continue to adhere to all COVID-19 protocols, even as vaccination is in progress. Back to you in the studio.
Thank you, Babajide Agbeyo, there, our Ekiti correspondent. Now, in the United Arab Emirates, UAE, over 9 million doses have been administered with the coronavirus vaccine, putting the rate of doses per 100 people to about 97.08. This is as it expands eligibility criteria for the COVID-19 vaccination. Our UAE correspondent, Maiwa Adegoke, joins us now from Dubai with more on this. Good to see you, Maiwa. So, the UAE appears to be vaccinating speedily. Give us an idea as to what's going on as it tries to bring its infection rate down.
It's good to see you, Millicent. And yes, the UAE is currently third on global rankings. So we're coming right after Israel and Seychelles. And the government is doing everything it can. If you remember, I did say earlier that they're trying to get the entire population vaccinated before the year is over. And they're very much dedicated to that. So previously, we had the priority list, just as many other countries did, where the frontliners were prioritized, and thereafter people aged 60 and above, as well as people with chronic illnesses. But we're over that now. Now it's open, so pretty much people can just walk into any vaccination center and get the jab. It's as easy as that. It's a little different if you have to go to a private institution or private hospital to get the vaccination. Then you need to book an appointment. But for the many vaccination centers owned by government spread across the country, you literally just walk in and get your vaccination as long as you're 18 years and above. Now we have 4 vaccinations available in the country. There's a Pfizer, there's Sinopharm, which was first rolled out because it was tested here. We also have AstraZeneca as well as Sputnik. So yes, the vaccination program and campaign, they're doing quite well. People are willing to take the vaccine. They're happy that they do not have to pay any amount to get it. And it's very easy to get it. So all is good over here. And it looks like before the year is over, the government will achieve that goal of vaccinating the entire population.
We also understand that the expansion also covers pregnant women. Is it all the vaccines?
So it's a bit different, right? So it's not pregnant women. What they're doing now is for women who are nursing mothers, as long as your baby is 6 months and above, you can get the vaccination. But if your baby is not up to 6 months, you cannot get the vaccination. For a woman, if you're not planning to get pregnant for another 3 months, you can take the vaccination. And that's because, the research hasn't pretty much covered this area. When a baby is being formed, there's a lot that goes into the process. You want to be careful that the baby doesn't, is not deformed in any way in the process of being made, right, in the womb. So a woman who's not planning to get pregnant for another 3 months can't take the vaccination, as well as any nursing mother with a baby 6 months and above.
Also, Maiwa, it's a different Ramadan this year, isn't it? I mean, but one can actually say a little better than 2020, right?
Definitely. This time last year, you know, as we all know, we were in the thick of it. There was lockdown at this time last year. Ramadan was very much stiff, so to speak. But now it's a lot merry. Mosques are open, so people do go to the mosques to pray, of course, with social distancing in place, strict mask wearing and all that. I dare to say that it's a lively Ramadan. Restaurants are open, although they have to close by 4 a.m., as well as hotels, cafes, and bars. So it definitely is, if you can say anything is lively in a pandemic, then it's definitely a lively Ramadan with rules in place. People have been advised to avoid large gatherings, of course. If you are more than 10 in a household, you're not advised to come together for the breaking of the fast, which is called iftar. So for iftar, it's limited to a household of 10 people. And, you know, as such, all the people are advised to keep away from the public and keep away from large gatherings, of course, to protect them. But definitely, it's a lively Ramadan this year, far better than it was last.
Okay, closing at 4 p.m. Well, thank you, UAE correspondent Maiwa Adegoke. Thanks, nice to see you again. Stay safe.
Thank you very much, Millicent.
Now, a microbiologist at Cambridge University who leads the UK's gene sequencing efforts to track COVID-19 variants says it is too early to say if the variant seen in India is to blame for its rising infection rate. She explains that the major surge seen in the country may be simply due to human behavior or the variant, or it might be a mix of the two. Let's take a look at the global report.
While the UK worries about the coronavirus variant in the country, the number of cases in India continues to rise. More than 273,810 new cases have been reported in the past 24 hours, marking the highest ever single-day spike since the outbreak started in the country. The newly added cases have pushed the nation's total tally beyond 15 million infections, and the country's death toll reached nearly 179,000. Government-held parts of Yemen have begun to receive their first shots of COVID-19 vaccine 3 weeks after the first shipment from the global COVAX vaccine sharing scheme arrived in the country. On March 31st, Yemen received 360,000 doses of the AstraZeneca vaccine, part of a consignment from COVAX expected to total 1.9 million doses this year. Lockdown measures in the Netherlands are expected to be eased from next week as pressure to reopen society mounts despite still high coronavirus infection rates. A nationwide nighttime curfew that has been in place for 3 months will be lifted on April 28th, and bars and restaurants will be allowed to gradually reopen next week. Authorities in New Zealand have reported that a worker in Auckland Airport has tested for COVID-19, but doubt whether the new case would warrant ordering a pause in quarantine-free travel with Australia. Australia and New Zealand opened a travel bubble on Monday, April 19, after both countries had closed borders in March last year to non-citizens and permanent residents to contain the pandemic.
Continue to take responsibility. You can visit our website. It's channelstv.com for more updates, also a better understanding of the pandemic. You can also find other stories there on politics, business and sports. It's all at your fingertips. Program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.